weapon down, sir! Put the weapon down!
The only time we ever hear about law enforcement and confrontation with mentally ill persons is if that person is in some way injured or killed. If an officer kills someone who's in a mental health crisis, we hear about it. But what we don't hear about is every day on the street, multiple times a day across our state, officers are confronting people who are mentally ill and often can be a threat to themselves or to others.
Drop the weapon!
The real question we're asking is Colorado providing the mental health services people need around the state? And the answer is no.
There's been numerous times that I've been finished. I've left this patient with the mental health counselor, left, gone to the station, finished my paperwork, come back out, and then patients walking down the street in front of me.
What we're hearing from cops on the street and deputies in jails is that most of their days now are spent dealing with people who are mentally ill. And these aren't professional mental health providers, these are law enforcement officers.
Let me help you, please.
Counties in the state of Colorado are now spending millions of dollars dealing with mental health issues where the state of Colorado can't provide the care that these people need.
We have a safety net system, safety net being the behavioral health system that guarantees services, right? That doesn't guarantee services, and that's a problem.
The lack of access to mental health services is having a dramatic impact on towns and cities across Colorado. You're seeing more people on the street who have mental health issues. You're seeing mental health calls to 911 on a daily basis. You're seeing cops on the street dealing with mentally ill people more than dealing with a robbery in progress. You're seeing deputies in jails being trained to deal with mentally ill people. So it's really changing the complexion of law enforcement and the criminal justice system in the state of Colorado.
It is part of our job, but I can't do a burglary in progress because I'm doing one mental patient or party having a bad day after another.
I need your help to help you, if you'll let me do it.
What was really amazing to me as we had these conversations with people around the state, both people who had been in mental health crises and also law enforcement, is the compassion law enforcement officers have for mentally ill persons who are in crisis.
I'm gonna tell you, I'm gonna get you some help. We're gonna start right now. I'm gonna get you over here to Parkview and we're gonna get it taken care of, okay?
In one case, we had an officer who was paralyzed by a person in crisis.
We are often the last line of defense in trying to get them the help they need. I think there could have been more provided to him to become healthy. More resources, more education on his part and on his family's part.
And not only do we talk to the officers about this, and in terms of their own training and how they must deal with people who are in this situation, in this crisis, but we've also been able to talk with the people in crisis who've come down from that crisis and talk with them about how they got there and the lack of access to care that they need, and how often they have tried to get care, tried to get services, but couldn't, and finally have spun out of control.
Yeah, put your hands behind your back. Go like this.
No! I could have died. I'm lucky that I was not shot and killed by the police.
And what we're seeing here is really the abdication of the responsibility of the state toward the mentally ill. And that responsibility is being pushed over to the criminal justice system, to the courts, to cops on the street, and to the deputies in the jails around Colorado.
I don't think it's fair for these mentally ill people that there's not enough resources, there's not enough facilities for them to go and get the proper treatment.
The state's failing these people.
We can do more. We will do more.
You know, working on a project like this takes hundreds of hours, going through records, documenting cases where police shootings have involved a mentally ill person or a person in mental health crisis, getting statistics from all the jails around the state of Colorado, traveling all over the state talking to sheriffs and police officers, going into case files, figuring out the detail of a specific case where officers have interceded and saved someone's life. All of these things take time and they take energy. And I think one of the things that around the state of Colorado we've found is that when we say we're from Rocky Mountain PBS, people are saying, okay, we know you're credible. Okay, we know you're trying to do the right thing. And I think that's been one of the most gratifying things in this project and so many other projects.